Hello, hello, hello. Good evening. So I really can't see anything. So I'm not going to be able to see if anybody is conversing with me. So I'm just going to go ahead and get started at 8:30. Thank you so much for joining me. It's my first time going live. I'm so excited. Okay. So hey everybody. I am Dr. Tamara McCants, and this is Pharmacy for the People. Pharmacy for the People is a concept that I came up with about a year ago when I was just trying to think about how I can reach my community through this social media platform. I'm not really technologically savvy, so I was just trying to figure out a way that I can reach the community like I have been doing for the last 20 years in the spirit of COVID and the shutdown and quarantine when we couldn't go live, go to live places anymore. But I'm just excited to have the opportunity to use my medication expertise to make sure the people in my community, the people that I love, can take care of themselves. So tonight, what we're going to do real quick is just make sure that us as healthcare professionals can provide clear messages to our community, clear, consistent messages from people that they trust, because it's a lot of information out there. So I want to utilize this platform to make sure that we could become on the same page so that when we're talking to our people, that they can trust us and know that we are all on the same page. So tonight, let's clarify the role of COVID-19 vaccines in the context of the Omicron variant. Somebody the other day called it the Omicron variant, and I was dying laughing because I am a love and hip hop fan, but I love Omicron. Shout out to Omicron. But the reason why we're talking about this, because anybody that has been living for the last 3 weeks know that COVID ruined everybody's Christmas, New Year's, all of our plans in the last 3 weeks because everybody and their mother got COVID. Now, we should be thankful that it just ruined our plans because there are hundreds of thousands of people that actually have died from COVID. So I just want to take a moment to just do a moment of silence for those that did actually die from COVID. And so, with that being said, we're not where we used to be, but people are still getting COVID. We're not dying from it like how we used to, but people are still getting COVID. And so, like I said, everybody and their mother got COVID within the last 3 weeks. People that were boosted, people that got one vaccine, people that got both of their shots. And of course, we have the unvaccinated people that also got COVID as well. So everybody is being affected. But the reason why I wanted to talk about this tonight is because I know what people have been going through when you get COVID. Because I myself, literally, I think to the day last year, caught COVID. Last year, I believe I caught it during the insurrection. Well, the day of the insurrection, and today is the anniversary for those of you that didn't know. And I, thank God, did not have a lot of symptoms, but I dealt with that anxiety and that guilt that comes with having COVID. So I know how people feel about it. I know the anxiety that comes with it. I gave 2 of my line sisters COVID. I was devastated. But, thankfully all of us pulled through. And it's so many of us that's pulling through, and we're getting it and we're surviving from it. And so now we don't, first thing I don't want you to do, I don't want you to feel guilty. If you have COVID and somebody got COVID that said they were around you, Don't feel guilty because COVID is literally everywhere. Nobody knows where they're getting it from. And nobody can pinpoint where they're getting it from because it is literally everywhere. And we're all at risk. But what we need to do is normalize COVID. We can't keep on being afraid of COVID. We need to be on the offense of COVID. We need to look COVID in its face and be like, what? And try to protect ourselves from it. So stop being scared of COVID. It's scary. People died from it. It was scary, but it's something that we are all able to manage and all make sure that we can, get past it. And so just because we're not being scared of it, though, doesn't mean that you're just going to be out here just doing whatever and trying to get sick, because nobody wants to get sick. But we need to teach the community to protect themselves. And so that's the message that I think that we need to be very consistent with. Don't be scared of COVID, but protect yourself from it. And so there's three main ways that people can protect themselves from COVID. The first way, and the most important way, is one, maintaining a strong immune system. I know y'all thought I was going to say to get the vaccine, but that's a whole nother story. And as a pharmacist and being a practicing pharmacist for the past 20 years and a proponent of immunizations, it is a good way to protect yourself from COVID, but the number one way is by making sure that we teach our communities to strengthen their immune systems. And so we teach them to strengthen their immune systems by making sure they get enough rest, that they decrease their stress, get exercise every day, and also eat healthy foods with a focus on foods that help to build their immune system. Citrus foods like we all know of, like limes and oranges, and some that we might not even think about, like oysters. So if you like oyster happy hours like me, when you go on a happy hour eating oysters, you're protecting your immune system. The second thing that we need to educate our community about is to ensure that they are wearing their mask and keeping their distance from people. We're a loving community. So, we like to love on each other, be in each other's face, hug on each other, talk in each other's face. But I think now and forevermore, we're going to have to tell people to just give me 50 feet, back up a little bit. So give people some space and have people wear their mask. So we keep on having this discussion, well, what kind of mask? I need a KN95. If you're not a healthcare professional, you don't really need that. What you really need to do is wear your mask properly. Don't wear your mask like a chin strap, like my mother would say, but put it on properly over your nose and your mouth. And I hate to break it to you, but the best mask that you can use is the blue mask. Yes, I'm talking about the blue mask that's 50 in a pack that costs like $9.99. They're not cute, but they are the most effective mask. And so we could kill two birds with one stone, where you could use a blue mask underneath and then you could put your cute mask on top, because wearing a mask, that's really the only way that we can protect yourself and protect each other. And last but definitely not least is the vaccine. There is so much misinformation out there about the vaccine that we could spend the whole night talking about it. But I just want to leave you with a couple of things. What has been consistent since the vaccines have been put on the market in December 2020 is that the vaccine has not caused anybody to die. There is no documentation that any of the COVID vaccines have killed anybody. Now, we all seen the YouTube videos with the metal and people going through convulsions and all of that. And even still, those people did not die. But what we do know is that COVID is killing people. And so the reason why that we're not dying as much as we are now is because so many more of us are vaccinated. And so we have boosted our immune system to the point to be able to protect against COVID. So that's why we need to get vaccinated. Definitely get your vaccine. If you have not gotten one shot yet, think about getting your shot tomorrow. Go to your local pharmacist. Of course, I'm going to say the pharmacist because we are the most accessible healthcare professional. But Go to your pharmacist and talk to them about it. If you're still a skeptic, at least have a conversation. Talk to your pharmacist about the vaccine. If you got your first shot because you were under pressure and you haven't finished your dosing yet, go ahead and get your second shot. And if you got both of your shots and you're eligible, then I encourage you to get your booster. Now, if you're still not convinced about the vaccine, that may be something that we can talk about another time. But I just want to let you know that we are all responsible for talking to each other to dispel all the myths and just figure out what we're going to do about COVID. But I want us to not be afraid of it. Thank you so much for joining me. Hopefully, I will see you next week, Thursday, same time, same place. Pharmacy for the people.